We have to get this man to a hospital, quickly.
In the year 2000, the World Health Organization ranked the healthcare systems of 191 countries. France came first, Italy came second, San Marino, Andorra, Malta, Singapore. The rankings went on. The United States came 37th, behind Morocco, behind Colombia, behind Costa Rica. The country that had invented the polio vaccine, pioneered open-heart surgery, developed chemotherapy, and built the most advanced hospital system in the world, ranked below countries with a fraction of its wealth, a fraction of its medical schools, and a fraction of its research budget. And here is the number that made the ranking truly inexplicable. The United States spends more money on healthcare per person than any other country on Earth, by a significant margin. Not 10% more, not 20% more, nearly twice as much. More money, worse outcomes. 37th place. This is the story of how America built the greatest medical system in the world and then broke it. The story of American medicine in the 20th century is, for most of it, genuinely extraordinary. In 1900, the average American life expectancy was 47 years. By 1950, it was 68. By 1980, it was 74. In 80 years, American medicine had added nearly 3 decades to the average life. The weapons it used to do this were remarkable. Penicillin, discovered in Britain but mass-produced and deployed first through American industrial might during World War II. The polio vaccine, developed by Jonas Salk at the University of Pittsburgh in 1955, which eliminated one of the most feared diseases in American history within a decade. The measles vaccine, the mumps vaccine, the rubella vaccine. One by one, the childhood diseases that had killed or crippled generations of Americans were conquered. The hospitals were building the future. The Mayo Clinic, Johns Hopkins, Massachusetts General, the Cleveland Clinic. These were not just hospitals, they were research empires, training the best doctors in the world, attracting the best medical minds from every country, and doing the work that made medicine better for everyone. American medical schools set the global standard. The National Institutes of Health, established with federal funding after World War II, became the largest funder of biomedical research in the world. The American model, research universities linked to teaching hospitals, funded by a combination of federal grants and private philanthropy, was copied everywhere. If you had cancer in 1970, you wanted to be treated in America. If you needed heart surgery in 1980, you wanted to be treated in America. If you wanted cutting-edge medicine, America was where you came. The American healthcare system was not designed. It grew. After World War II, the federal government passed the Hill-Burton Act in 1946, which poured billions into building new hospitals across the country. Hundreds of new facilities opened through the 1950s and 1960s. The supply of hospital beds expanded dramatically. At the same time, a uniquely American institution took hold: employer-sponsored health insurance. During World War II, with wages frozen by the government, companies competed for workers by offering health benefits instead. After the war, the practice stuck. By the 1960s, most Americans with good jobs received health insurance through their employers. The system was not universal. It left out the unemployed, the self-employed, and the poor. But for the majority of Americans, it worked. In 1965, President Lyndon Johnson signed Medicare and Medicaid into law, health coverage for the elderly and for low-income Americans. It was the closest the United States ever came to universal health care, and it was fiercely opposed by the American Medical Association, which feared government control of medicine. The system that emerged was a patchwork. Some people had employer coverage, some had Medicare, some had Medicaid, some had nothing. But for those who had coverage, the medicine available was world-class. The problem was that nobody was controlling the costs. Through the 1970s, 1980s, and 1990s, the cost of American healthcare rose at a rate that should have set off alarms in every boardroom and every capital office in the country. In 1970, the U.S. spent about 7% of its GDP on healthcare. By 1990, it was 12%. By 2010, it was 17%. Today, it approaches 20%. Nearly 1/5 of everything the American economy produces goes toward healthcare. No other country comes close. The next highest spenders, Germany, France, Switzerland, spend around 11 to 12%. They cover everyone. Americans spend more and leave tens of millions uninsured. Several forces drove the cost explosion. The fee-for-service model paid doctors and hospitals for every procedure they performed, so more procedures meant more revenue. There was no incentive to keep patients healthy. There was every incentive to treat illness after it occurred, expensively. Pharmaceutical companies in the United States operate in a unique environment. They can charge whatever the market will bear. The same drug that costs $10 in Canada or Germany can cost $200 in the United States. There is no government body that negotiates drug prices at the national level. Administrative costs in the American system are staggering because there are hundreds of different insurance companies, each with different rules. Hospitals and doctors' offices employ enormous administrative staffs just to handle the billing. Estimates suggest that administrative costs account for roughly 30% of all healthcare spending in the U.S., compared to around 12% in countries with simpler, more unified systems. And through it all, the outcomes got worse, not in absolute terms, but relative to peers. Other wealthy countries were improving their health outcomes faster than America was. When the WHO released its global healthcare ranking in 2000, the United States government's response was roughly, "The methodology is flawed." That was partially true. The ranking weighted healthcare equity heavily, meaning systems that provided equal access to all citizens scored better than systems that provided spectacular care to some and little to others. A single-payer system in a small European country could score well even with more modest medical technology, simply because everyone had access. America's system was first in the world in responsiveness, meaning when you showed up at a hospital, you got fast, sophisticated, high-tech care. The problem was who got to show up. By 2000, approximately 40 million Americans had no health insurance. For those people, the greatest hospital system in the world was effectively inaccessible. They delayed care until emergencies. They went to emergency rooms for conditions that should have been managed by a primary care doctor years earlier. They died from things that were preventable, and the numbers that are harder to explain away. Infant mortality. The United States has a higher infant mortality rate than virtually all of its peer nations. Countries with lower incomes, smaller hospitals, and less advanced technology. Maternal mortality. America has the highest maternal death rate of any wealthy country, and it has been getting worse, not better, while every comparable nation has been improving. Life expectancy. In 1980, Americans lived about as long as people in comparable wealthy countries. Today, the gap has grown substantially. Americans die younger than people in France, Germany, Japan, Australia, Canada, and dozens of other countries. The medicine is excellent. The system around it is broken. The 37th ranking is, at this point, more than 2 decades old. More recent analyses have ranked the U.S. even lower in some measures, dead last among high-income countries on overall health outcomes in the Commonwealth Fund's 2024 report. What does last place look like in practice? The U.S. has the highest rate of preventable deaths among wealthy countries, the highest rate of deaths from treatable conditions, the highest obesity rate, the highest rate of maternal mortality, one of the highest infant mortality rates, the lowest life expectancy among its peers. At the same time, the U.S. leads the world in cancer survival rates for many of the most common cancers. It has the most Nobel Prize winners in medicine and physiology of any country. Its research institutions are still the envy of the world. Its hospitals, for those with access and insurance, remain among the best anywhere. The paradox of American healthcare is that it contains both the best and the worst. A wealthy, insured American with cancer gets some of the finest treatment on earth. A low-income American without insurance in a rural area may have no meaningful access to primary care at all. The system costs more than any other. It covers fewer people than any comparable peer, and it produces worse outcomes on the measures that matter most. In 1955, Jonas Salk stood before the cameras and announced that his polio vaccine worked. Parents across America wept with relief. Within a decade, a disease that had paralyzed tens of thousands of children every year was essentially eliminated. That moment, American science, American investment, American ingenuity producing a result that saved millions of lives, represents what the American healthcare system was capable of at its best. The infrastructure that produced that moment is still there. The research universities, the teaching hospitals, the scientists, the equipment. What changed is the system around them. At some point in the second half of the 20th century, American healthcare stopped being a system designed to keep people healthy and became a system designed to generate revenue. The incentives changed, the focus shifted, the costs exploded, and the people who couldn't pay fell through the cracks. The country that ranked 37th is the same country that invented the polio vaccine. It has the same scientists, the same hospitals, the same ambition. It just forgot what it was building them for. The WHO ranked the U.S. healthcare system 37th in the world in 2000. The U.S. spends nearly twice as much per capita on healthcare as comparable wealthy nations. The 2024 Commonwealth Fund report ranked the U.S. last among 10 high-income countries on overall health system performance. Approximately 26 million Americans remain uninsured.